This is one of my all-time favorite pictures. This is a young boy with hemophilia who had just stuck himself for the first time. I kept this picture framed over my desk all throughout medical school. Whenever I was sitting there studying and kind of stressed and kind of lost sight of the reason I was doing this, I'd look up at this picture and remind me of why I was doing this, to teach others how to take care of themselves. And so this was a big part of helping me get through medical school.
One of the things I learned really quickly in medical school that set me apart from other people is that I had gone through a lot of the things that some of the patients that we would see go through. And it really helped me to understand, maybe not their specific situation, but what it's like to be in a hospital, what it's like to maybe not get out of a bed or depend on somebody else to help you. Just having that awareness really helped me to think about what it's like to be a patient and have a different level of empathy than I might have otherwise.
I always had a special sense about, or I guess a feeling for hospitals. I've always felt comfortable going to them because I just had to go. I didn't really have plans when I initially came here to make a full career in public health or in the health field, but as one thing kind of fell into place after the next, it just seemed to work. And I'd always heard people say, you know, pick your passion and just kind of go with that. And the more I studied or learned or worked in the field of public health, it became just kind of a good fit.
I would certainly recommend that young people that have been exposed to the hemophilia community consider a career in healthcare. There's so many opportunities. You can be a nurse, you can be an occupational therapist, which is what my sister does actually, and she loves it. Physical therapist, nursing aide, physician. There's so many opportunities, and with your background and your knowledge of how the healthcare system works, you already have a leg up on all the other people that are applying for these jobs.
When I was a kid growing up, I was pretty involved in the hemophilia community, and it helped me out a lot because being a kid growing up with this really rare bleeding disorder is kind of tough, because the one thing you don't want to be when you're a kid is different. I
first started going to the Hole in the Wall Gang Camp in 1995 at the age of 13, and as soon as I stepped off the bus up there in Connecticut, I loved it, and it's the greatest week of your life. Did so many different things, met so many cool people. I went back every year after that until 2004 in different capacities. I was a junior counselor, then a counselor, then a unit leader, and then I got to go back one summer and work with all the junior counselors, which was really cool. It's just been such a great experience, and it's a huge part of why I went into medicine along with having hemophilia.
You know, when I'm thinking about kids that are at camp, you know, you want to encourage them to reach high and do whatever they want, but at the same time not try to narrow it by saying, oh, we need you to save the community, we need you to do be a doctor or be a nurse. If they want to do that, that's great, but there are a lot of options out there too. So.